Kadla Yerbi. I'm going to have you guys help us out here, okay? So perfect, everybody. I wanted to thank everybody for joining us today, all of our Facebook community, all the individuals that are joining us live on Zoom. This is going to be a tremendous conversation because it's critically important for the work that we do and the work that we all do in our communities to really protect our families and friends. So today it's going to be about facts, not misinformation, right? Let's talk about the COVID-19 vaccine and what does that mean? Some of the things that we know already is that the first case of coronavirus was recorded and reported in LA County over about a year ago. But since then, Altamed has been part of the historic effort to keep our communities safe. Latinos and Black American communities continue to be disproportionately affected by this pandemic, not only by the coronavirus itself, but also by the subsequent economic downturn. Although the vaccine is available in California now, recent data shows that these communities are still experiencing inequities in their access to it. According to some of the early data that was provided to the California Department of Public Health, only 16% of the vaccines have been administered to Latinos, and only 3% of them have gone to Black Californians. While it's still unclear if these numbers are results of either misbelief around the vaccine or if it's a matter of access, we at Altamed are committed to keep our communities up to date about the latest news on vaccine distribution and the importance of receiving the vaccine once the vaccine is available. So what do we know now? We know now that Altamed has the vaccine for our patients and some of our patients in LA and Orange County that align with the phases that we see here, phase 1A and 1B. And as you can see by the bullet points that are listed here, it's really the critical health care workers, residents age 65 and above, education employees. We want to get our kids back to school, right? Food service, grocery workers and agricultural workers, childcare providers, and emergency services employees. Right? So that's what we're focused on currently, but there's so much more work happening. So what I'd like to do is take a little bit of a deeper dive with you all in some of that work. And we've got some incredible leaders with us today. Dr. Efrain Talamantes, our Senior Vice President and Chief Operations Officer. Dr. Cheryl Brown, our Medical Director of Infection Prevention. And Dr. Eloisa Gonzalez, Los Angeles Department of Public Health. And I couldn't do them justice in trying to introduce them and speak to the passion that they have. So I want to ask them to be able to introduce themselves to you so you can understand who they are. So Dr. Talamantes, would you mind introducing yourself and then Dr. Brown and Dr. Gonzalez?
Thank you so much, Milan, for that introduction. And it's not only a real opportunity for us to reflect. I'm Efrain Talamantes. I'm the Chief Operating Officer, also practicing internal medicine physician here at Altamed, and my clinic's in Ball Heights. And when I think about the impact of the pandemic and the dark place we've been, is I think about the story that my patient shared with me regarding her husband. They had been doing everything they could to stay protected, followed every single direction. And one day he woke up not feeling well and a little disoriented, and shared with his wife that he was very thankful for all the flowers that she had brought to the house. And she was confused and said, well, what flowers? I don't see any flowers. 30 days later, he had passed away at one of our hospitals here in East Los Angeles. She wasn't able to see him for the majority of those 30 days. By the time she was able or given permission to see him, he was in conditions that she couldn't recognize. And even though we've been in these dark places, and she was very much depressed, given the loss of her love, and she told me how they met and how they grew together. But she was hopeful, and that's because of the vaccine we have and the further losses that she wants to prevent. Her sons and daughters, her grandchildren. And so today we are here as a panel to really share the optimism we have. Almost 92 million Americans have received this vaccine. And the impacts or effects that we've seen or the benefits are yet to come. I mean, we're starting to get excited about some of them, given some of the recent announcements regarding people who are vaccinated that can now come together. And that's because this vaccine is allowing us to stop being in these dark places where we're fearful of what can happen if we do come together and spread the virus, right? And so as we look forward, I'm very optimistic. The work that Ultimed is leading to ensure that every single patient that comes our way has access to the vaccine is important. But the collective action of all of us here is that it's not going to be good enough for just us to receive the vaccine or for a few of us to receive the vaccine. And the question really is, what are we all going to do together to ensure we can get this vaccine out, to ensure that people have the information to make the best decision for them and their families to prevent another death, and ensure that we're also there for our patients when they have questions or they're going through their own losses, to make sure that we not only vaccinate them, but that we continue to be there for them throughout this COVID recovery. So thank you, Milan.
Thank you very much, Dr. Talamantes. Dr. Brown, would you introduce yourself?
Hi there. Thank you so much for having me. Thank you, Milan. So I am Dr. Cheryl Brown. I'm the Medical Director of Infection Prevention at Ultimed, and I've been working at Ultimed for 2 years, and it has been the time of my life. I've been fortunate enough to work with so many individuals at Ultimed during this last year, during the pandemic, really trying to help save as many lives as we can. And I'm so excited to be able to offer this vaccine to our patients and to our communities, because like Dr. Talamantes said, it's really the key to us being able to get our lives back. And we all need to get vaccinated so that we can all start rejoining society again, opening our schools, opening our businesses, and just trying to make up for all this lost time in this last year. This pandemic has just caused so many tragedies for our community, and it's time for us to rebuild, and that is started with this vaccine. So we want everybody to get vaccinated. Thank you so much.
Thank you very much, Dr. Brown. And now I want to introduce Dr. Eloisa Gonzalez. Doctor?
Sorry, I was muted. Good morning or afternoon, and thank you for having me today. So again, Dr. Eloisa Gonzalez with the LA County Department of Public Health, vaccine, Spanish media spokesperson.
Fantastic, fantastic. And you know, I always miss this too, but because I get so excited about these conversations. My name is Milan de la Rocha. I'm Assistant Vice President of Business Growth and Innovation here at Ultimed, but it is truly my honor to be able to host such an amazing conversation with these incredible leaders and with you all, right? Because this is what this is about. It's about getting your questions and asking the people that are leading these efforts, right? So any question is a good question. And I want to make sure that everybody knows that you could either submit questions through the Facebook Live in the comments, right? We have somebody keeping an eye on those and they'll pop those over to me. And also you can submit them through the chat function of Zoom as well. So we've got teams that are monitoring those questions, and I'll make sure that I kick those off to all the different panelists for us, okay? Lastly, this session is being recorded and it's going to be housed at Ultimed's Facebook page. We'll be sure to follow up with a link so that you can, again, have it and share it, because we want this information to be dispersed through our community. So make sure that you put your questions in the chat box, whether it's in Facebook or it's over here in Zoom, okay? Because this is going to be good and we need to hear from you guys as well. All right, so now that we got a little bit of an intro from everybody, what I wanted to do is really start to kick us off, right? We've talked about equity. We've talked about what that means for our community, and we all understand the importance of that. Right? But how does that get applied to what we're working through, right? And so what I'd really like to do is just ask Dr. Talamantes. We understand that Latinos and underserved communities are disproportionately impacted by COVID-19, not just here, but across the country. Could you start to tell us a little bit about how AltaMed or you are seeing that we are addressing some of those health equity issues and access issues to ensure that we vaccinate our community, Doctor?
Yeah, as I think about, going into this pandemic, we're all very familiar with the existing injustices and inequities in our healthcare system. To give you one example, coming into the pandemic, AltaMed has been working on the Latino physician shortage for the last 50 plus years. Because many of us who live in these communities, come from these communities, go to college, get all the accolades to apply to medical school. And for some reason, we still don't get in, right? We're turned away. Many of us may pursue different careers, but there are some inequities in the systems where maybe the school we went to wasn't good enough, or maybe the people we worked with, the mentors we had, don't have the same clout as others. And in healthcare, it's similar. We've been on a journey to build an infrastructure as community health centers for the communities that have the most need. So when you look at where we are as community health centers, we're in some of the most underserved areas in the country. When you look at social vulnerability, we have patients in those communities that are the most vulnerable Californians, most vulnerable individuals in the whole country. And it is a multitude of different factors that contribute to inequities in health and healthcare. We have to think as a system how we address the challenges to make healthcare more accessible. What's been the greatest learning for us in the last several year now is that there's an opportunity for us to rethink how we deliver services, how we get closer to patients to get them services where they need. Not only has technology allowed for that, like telehealth, but also that we are looking at, for the first time, how do we really think about getting vaccines to the most vulnerable? We've been vaccinating people for hundreds of years, right? If you look at the quantity of efforts to get people inoculated to fight off disease, we've been doing that for a long time. But we're now starting to look at, well, how could we be more effective to get vaccines to some of the neediest places? And we've been part of that struggle, was not only trying to get AltaMed vaccines, but other community health centers that face similar challenges to us. And ensuring that those vaccines not only get to us, but we have flexibilities to get them into the arms of the folks that need them the most. And the only thing I would ask of us as we think about these challenges is to put ourselves in the shoes of those individuals who are working multiple jobs, who have a very limited amount of time, and who want to get the vaccine, and they're not resistant, but they need that opportunity. And so when we talk about what are we doing at AltaMed, is we're clearly challenged with and making sure everyone understands that it is our responsibility as leaders to make sure that we give every patient and their family and their community every opportunity to get vaccinated, whether it's today, whether it's tomorrow, whether it's next week. So as they become eligible, it is our responsibility to make sure that they don't have to go from one side of the city to another part of the city, because we know how challenging that is for our communities. And those are some of the barriers that we continue to address through a variety of different ways, getting the vaccines to all our clinics, a huge endeavor, but also making sure we partner with community to make it easy, not only language, but understanding, well, why are people, what do they need, whether it's transportation, or maybe they're grieving. Maybe they need a counselor to help them through their grieving process because they lost somebody in these communities. And we see that quite often in our communities, is that people are grieving. And so if we don't address the grief first, we're not going to get to the vaccine, right? So we have to ensure that the approaches we take are sensitive to what the communities are asking us for.
Thank you very much, Dr. Talamantes. And I know that we've learned a lot, and I know that a lot of individuals have seen a lot of these articles as well. As we know about Latino populations, and we know about a lot of our community here, they tend to take care of not only their children, but also their parents in home. And what we know about our communities is that the majority of them aren't able to be working remotely. The majority of them are the essential workers that are out there in our grocery stores, in the restaurants, in the jobs that are necessary to keep our economy and society still running, even at the hindered level that it is at this moment. And so I know that we've seen a little bit more that because of the tight collections of these families, it impacts that family more often. How have you seen that play out in some of our communities, and what are some of the real factors that are disproportionately our communities in our service area?
Sorry about that. As you know, part of the challenge, I think, for us as a health system is we are continuously trying to ensure that our policymakers have the right narrative to ensure we get the resources to get people vaccinated. And oftentimes, what we've seen throughout this pandemic is that a touch and go approach is what we're being asked to take on. But when people come to us, it's not just about the vaccine. It's years of withholding care, of not getting care for unattended issues, medical conditions, unattended many years of being challenged with housing insecurity, stressors related to not having access to good jobs, years of food insecurity, living in food deserts. And I think that part of what I'm hopeful as I think about moving forward as a health system is that today I am confident more than ever that not only does our leadership understand this, and it's been an incredible vision of our CEO, Casulo de la Rocha, to build this organization with those intentions in mind. But today I can go to anyone across the organization and they fully grasp this. Equity is no longer an ideal that they're reaching for. They are finding ways to help us. We have an incredible team who's holding us accountable to make sure that we help them address these gaps. Because part of it is not just ensuring that our patients have great access to primary care, but that they have great access to addressing the social barriers, also known and referred to as the social influencers of health, that we address those. And the more we do that holistically, the community will benefit. It is no good for us, and this pandemic has made that clear, that I'm healthy, but my neighbor is not. Because when I come in contact with that neighbor, then I'm going to be impacted by that, by manyfold, not just getting the virus, but there's a lot of subsequent changes that happen in that community. And imagine that is really what's happened in the last year, is that our communities have been decimated by this virus. And as you've shared, continue to really impact. What the future holds is we have a greater responsibility now for those communities. And so equity moving forward has to be front and center in order for us to really shape our healthcare system to be even more effective than it was a year ago.
Thank you very much, Dr. Talamantes. And, you know, and unfortunately, I think a lot of us have recognized this even before COVID. But let's get real, let's get down to the real here, right? The vaccines that we've all heard about, right? Moderna, Pfizer, Johnson and Johnson, et cetera, right? Why should we get it? If my sister's pregnant right now, can she get it? Is there issues there? What kind of precautions do we still need to take, right? Are there side effects? How does that, and the effectiveness, why aren't any of these 100%, right? All the questions that we hear, right? So I'm going to have to say, Dr. Talamantes, I got to bring in a great mind to help us dig through those types of questions. So I got to invite Dr. Cheryl Brown up here, our medical director of infection prevention that is leading these things and is just, Dr. Brown, can you help us address some of these questions, some of the things that you've heard? And I've got quite a few coming up here as well. So I'll teach them off to you as well. But those are some of the big ones that you already know.
Sure. Yeah. Thank you so much. So I'm going to address one of the initial questions that you had. We have 3 vaccines now that have been approved. What's the difference between them? Do we need to compare them? Those are a lot of the questions that we're getting. So I wanted to address that. So the 3 vaccines that have been approved are our Pfizer vaccine, our Moderna vaccine. Those both require 2 doses. And then our Johnson & Johnson vaccine. It's a mouthful, but that's the most recent vaccine that was approved, and that is a 1-dose vaccine. So all 3 of those vaccines, they've never been compared in a head-to-head trial. So they were all we can only look at the data that came out of their individual trials. The Pfizer and the Moderna vaccine, those are both mRNA vaccines. It's a newer technology for vaccines, but it's actually been around for over 10 years looking at developing other types of medications. So those trials were done earlier on in the pandemic, from September to November. Around that time, we didn't have the variants that we're talking about right now. So the vaccine was,
RNA type of stuff. Is that the thing that's like going to change our DNA and turn my eyes blue? And
no. Great question. So mRNA is just, it's basically a messenger to our cells, that it's a little blueprint. It never goes into our DNA. None of the vaccines get incorporated into our DNA. They just give our cells a little bit of a message and say, hey, this is what you need to make an antibody to. So it's a blueprint for our cells so that we can build antibodies to the infection so that we can stop the infection. Yeah.
It's almost like a little, the vaccine is not the live virus. So you're not getting infected with COVID at all. Right? It's not the live virus, but what it is almost like a wanted poster that's coming into the body saying, this is what you all have to look out for. We got to be prepared for this, right? Is that a good analogy for that?
So that's a great analogy. I hadn't heard of the wanted poster, but yes, it's basically showing our cells what we could be coming up against so that they know how to make the defenses. So it's giving them a sneak peek of how they can fight the virus if they were ever to come in contact with it. But none of these vaccines, all 3 of these vaccines, none of them are live virus vaccines for COVID. None of them can give you COVID. Yeah. And I want to say that 100% of them, all 3 trials showed that they were 100% effective at preventing deaths, which is great. All 3 of them were 85% or better effective at preventing hospitalizations. So that's what we really want to prevent. We want to prevent hospitalizations and we want to prevent deaths. And all 3 of these vaccines are excellent at being able to stop hospitalizations and stop deaths from COVID.
One of the thoughts that comes up that I'm seeing in some of the questions here, Doctor, is 85%, right? But wouldn't I want the 95%, or do I wait for 100%? Because I mean, I've been getting flu shots for a long time, and I got vaccinated when I was a kid, and those are really good.
Yeah, so all of our vaccines, they all have a percentage of effectiveness. The flu vaccine, we're happy if it has greater than 50% effectiveness for the flu for the actual flu viruses that it's trying to target. So over 50% is a really good vaccine. All of these vaccines are way over that target. They all work really, really well. And the whole point of it is for us to stop this pandemic. We're not shopping for our, brand new car that we're going to have for the next 10 years. No, we want to get the first vaccine that is available to us so that we decrease our risk from getting infected with COVID. We protect ourselves from going to the hospital or dying of COVID. We protect our family members, our friends, our coworkers. We protect our community when we get vaccinated and when we recommend that others get vaccinated.
That is tremendous news, doctor. I did not know that. I know that these flu vaccines, polio vaccines, measles vaccines, all the vaccines that we get as a child, I just thought you were 100% safe, but now I'm realizing, you still get a flu shot every year as a preventative measure, right?
Well, yeah, I mean, they both work together. So there's an effectiveness of the single vaccine. So this one person, we are protected, ideally, yes, everybody wants to be protected 100% from everything, but we're protected a certain percentage. And if all of the people around us are also protected with the vaccine, that's when we talk about herd immunity. That's when those two things come together and we get the 100% effectiveness. That's when you get the vaccine and everybody else gets vaccinated around you.
Makes a lot of sense. Now I can better understand the herd immunity piece and how we get to that level. So it's critically important that we get this. But doc, in all honesty, I don't like shots. If I go to get the shot, I'm like, where's the pediatric needle? Where's the baby needle? Give me that. But is this something do you believe this is something that we're going to have to do every year moving forward? Like the flu vaccine, we're going to need to get a COVID vaccine?
Yeah, so, like you said, the flu vaccine, we recommend that everybody get the flu vaccine every year. And the whole reason behind that is because getting the flu is way worse than the one single needle that you're going to get from the having to get the flu vaccine. So we want to prevent ourselves from getting sick from the flu, preventing ourselves from winding up in the hospital, but also protecting those around us, especially those people that aren't able to get the vaccine, like babies less than 6 months old cannot get the flu vaccine. So that's why it's so important for us to get the flu vaccine. We don't know yet whether we're going to have to get annual booster shots of the COVID vaccine. And so we're still waiting to look to see, look at the data, look to see how long we have immunity from the vaccines. There's these new variants that are coming out, so they may create some updated vaccines to give us a little booster to protect us from those variants. Right now, all three of these vaccines, though, are protecting really well against the variants, protecting it against hospitalizations and deaths, which is exactly what we want them to be doing.
Very good, doctor. You led me to a couple other questions that I see here as well. Let's talk a little bit about about the age categories, right? You mentioned, can anybody get this? And how do these vaccines apply to small children? And how do they apply to teens, adults, seniors? Is there anything that we've got to be mindful about from that sense?
Yeah, so fortunately, the COVID virus, right, the COVID-19 infection, it is milder in children. So children are less likely to wind up in the hospital or dying of COVID, less likely to have a serious complication related to COVID. Other people that are more likely to get sick and die of COVID are 65 and overs. Those are the ones, that's why we started focusing on the 65 and over individuals first, because they're more likely to get sick and die of COVID. So we want to protect them. We want to protect the most vulnerable first. And that includes all of our essential workers. So our healthcare workers, all those people that have to leave their homes every day to go to work and protect our community, we need to vaccinate those people first. So it's going according to a prioritization tier. So that's why we're doing that. The vaccines themselves, the Pfizer vaccine is approved for people that are 16 and over. The Moderna and the Johnson & Johnson vaccine, that's approved for people that are 18 and over. All three of the vaccine manufacturers are conducting studies in younger kids now. So hopefully, within the next 6 months to a year, it will be approved. We'll have an approved vaccine for younger children as well. But we have to get those most vulnerable to COVID-19. We have to get those people vaccinated first.
That makes a lot of sense, doctor. That makes a lot of sense. Thank you for that information. And I think I want to ask you one thing, because I know my sister, and I know she's got a little one in the oven right now. How does this, what's the info about women that are pregnant, right? How does this affect them? What do we need to be thinking about, or what can we do to help educate these amazing
Sure.
women? And
Yes.
happy International Women's Day yesterday as well, and Women's History Month to all our fantastic and incredible women out there.
Well, thank you and congratulations to you and your sister. That's exciting to have a new baby in the household. So, yes, I mean, this is a common question that comes up. And now, what I want to say is that these three vaccines, whenever you're doing a vaccine trial, you're going to do it on a certain proportion of the population. So typically, they don't start off with vaccine trials in pregnant or lactating women. Those are just individuals that we don't typically include in the first trials for vaccines. So that's one of the reasons why they weren't purposefully involved in developing the vaccines in the beginning. But there were multiple people that got pregnant during the trials with all three of these vaccines. They didn't see any complications in those pregnancies or anyone that was lactating. We have no evidence thus far. Dr. Talamantes mentioned that over 90 million people have been vaccinated. We're collecting data on safety for these vaccines for everybody that gets vaccinated. Anyone that has an adverse reaction to the vaccine, doctors are reporting that to the CDC. So they are compiling data on millions of individuals. Thousands of people have gotten this vaccine thus far that are pregnant and that are breastfeeding, and they're looking at all that data. There's no evidence in any of that data that the vaccines affect fertility, they don't affect pregnancy, and they don't affect breastfeeding. We know that the COVID-19 infection is worse for our pregnant individuals. It's worse for the babies that they're pregnant with. So we know that the risk of getting COVID is really high. So for our pregnant individuals that are going outside of the home, that are healthcare workers, or have other risks, just being pregnant is at increased risk of having a severe complication for COVID. The benefit of getting vaccinated and preventing a hospitalization, preventing of a death, far outweighs us just not having that initial testing in the pregnant individuals. But we have so much data now showing how safe it is in pregnant individuals since the vaccines have come out. So it's really, really reassuring. Of course, if you ever have any questions about the vaccine, our pregnant individuals, thankfully, they have providers, healthcare providers that they can talk to. So talk to your trusted healthcare provider so that they can answer your questions and reassure you that it's safe to get the vaccine. And lastly, the babies need us to be healthy, right? The babies are not going to be doing well if mama is not healthy. So mama needs to stay healthy so that the baby can be taken care of. And the best way to get mama safe and protected is to get mama vaccinated.
That is tremendous information, and I'm going to definitely reiterate all of those things. I'm going to send her the recording for this thing. That's what I'm going to do, because I know we get that a lot. And I think what we've seen in a lot of our community, or at least in my generation here, and I'll say I'm 35 years old, so I barely cut tail into the millennials. So much of us are having children later in life. And I didn't even realize that after 35, it becomes a geriatric pregnancy. So it's a higher risk pregnancy, right? But we see those things. So it already, like you mentioned, is higher risk, but then the complications of COVID on top of that is just exponentially makes it more risky. So we got to talk a little bit about what the age brackets are, right? So children under the age of 18 at this point, we are still getting more information, and there are trials going on now. Obviously, that's top of mind in news and society because everybody wants to get their kids back, right? We aren't are set up to be teachers at home. So those are things that are real, right? And so I see a couple other questions that I'm going to throw out to a couple other people here. But I wanted to, the last little piece that I just wanted to touch on here is also, everybody, these are the types of live conversations we have. But if you want to get these type of updated information on a more readily and steadily and consistent basis, go to altamed.org/vaccine. And on that page, there'll be a little sign up form for our critical COVID updates. Okay, so as the categories change, as more individuals become eligible, if you're on that list, you're going to get hit directly as we get that news. It comes to us, it comes to you, you get set up, you get scheduled, you get vaccinated, right? So that's a critically important piece and a critical resource for us all. So you don't have to come and dig through the CDC and the like. You're going to hear it directly from these doctors of what needs to happen right here, right now, okay? So let's make sure that you get all your questions in. I do see some more questions, but I'm going to hop over now to Dr. Eloisa Gonzalez, unless there's anything else you'd like to share with us, Dr. Brown, any other key points?
Yeah, so a lot of people want to know why should I get vaccinated? As Dr. Talamantes mentioned, people that are fully vaccinated, there's some information out now that we can start participating in more activities. So I think that that's definitely an incentive for people to get vaccinated. The sooner that we can all get vaccinated, as I mentioned before, the sooner we can stop this pandemic and start turning our lives back around. We still need to be careful, though. With the variants coming out, we need to be paying attention to all the updated recommendations. Right now, if you're fully vaccinated, you're able to hang out with other fully vaccinated people. I'm making my list of all my friends that are fully vaccinated. You know what I mean? But they may then turn that around and say, okay, with the variants out, we need to hold on until you get our booster. So continue to follow the recommendations that are mentioned. I want to say the vaccine's free to everybody. You do not have to pay for this vaccine. It cannot give you COVID. No one can get the COVID infection from the vaccine, and it will not cause a COVID test, a PCR test, or an antigen test. It will not cause it to be positive. So that is good. It is important, even if you've had COVID infection, the vaccine actually gives you more immunity, a longer lasting immunity than a natural infection. So that's why it's still important to get vaccinated, even if you had the COVID infection. 90 million or more people have been vaccinated in the US so far. We don't see any safety concerns or signals in any of that information. We're carefully monitored after you get the vaccine. So for 15 minutes or 30 minutes after you get the vaccine, there's healthcare providers that are watching you to make sure that you're doing well after the vaccine. There are some, when we're developing antibodies in our body for anything, for any vaccine, we sometimes have some symptoms with developing antibodies. And those can be fever, fatigue, we can feel muscle body aches. It can kind of feel like we're coming down with a little cold or a little flu. Those are normal symptoms. They usually only last for a day or two. They're fairly common with these vaccines, but again, they're normal. So I would time it right. When I got my vaccine on a Friday and I was off on Saturday, but try to time it, if you can, before you're going to be off for a day. That would be ideal. Not everybody has to take time off. Most people don't have to take time off, but just to be prepared. The Johnson & Johnson vaccine is one and done. So if you don't like needles like Milan, maybe that's the one for you. So you don't have to have 2 shots. You only have to have 1. And I wanted to mention those things because those are a lot of the same questions that come up too.
No. Like I've heard the doctors say, what's the best vaccine to get is the one that you can get in your arm.
That's exactly right.
Vaccine to get, because they're all going to provide a level significantly greater than what we've even seen for the flu or any of the other vaccines when we talk about efficacy and protection. Blah, blah, blah. So perfect. That is incredible. Very, very good news. And I do see some questions that I think we can address about, well, when can we stop wearing masks? Well, we can stop wearing masks once we get to that herd immunity level. So even once you're vaccinated, it's still important to wear that mask, okay? Because we need to take those precautions still everybody. So that's just a critical component. But Dr. Brown, I just wanted to thank you so much for everything that you've shared with us. Critically important. And everybody, if you got any more questions that Dr. Brown has sparked or came to your mind, make sure you get them into those chat boxes so we can get them answered, okay? I am seeing a lot of people asking about whether we would do this in Spanish. Yes, we will do this in Spanish as well, okay? I made that decision right now that yes, we are going to do it, but I hope our panelists are open to that as well. And Dr. Gonzalez, what I'd like to do is invite you to kind of.
I'm sorry, Milan, you're muted.
I dropped my voice out there. My little fat finger slipped off my space bar. If you've got some responses that you want to give to any of the questions in Spanish as well, please feel free. Please feel free to do that. I am seeing some of those things, but can you tell us a little bit about the efforts to create access to the vaccine in LA County as you see it, and tell us about some of the tremendous work that you're doing?
It'd be my pleasure, Milan. So right now, really creating access to the vaccine for our most vulnerable populations is really requiring some creative ways of mitigating barriers in order to increase that access to vaccination. For example, we know that navigating an online registration system is a major barrier for a lot of people. So we've been working with a number of community leaders and organizations who are actually handling that registration process for those individuals who are eligible but not readily able to use the online registration themselves. In addition, we have a call center that's also been able to help people get registered. And that call center is available 8 a.m. to 8:30 p.m., 7 days a week. That number, in case you don't have it, is 833-540-0473. And approximately 3,000 appointments just this week alone at our county-run sites are being filled through these couple of efforts. Many of our community vaccination partners are also eliminating online registration requirements for their patients so that they can show up without a scheduled appointment and still be able to, as long as they can prove that they're in an eligible category, be able to get the vaccine. And then we also have mobile vaccination teams that are out getting individuals registered on site for vaccination. We also know that mobility limitations, including transportation challenges, are also issues for a lot of people. So we're continuing to send these mobile teams with our partners from Curative to senior residential communities, and especially in areas that have had low vaccination rates. We're also coordinating with rideshare companies like Uber to provide additional transportation options for people who are eligible to be vaccinated. Currently, we're distributing 1,500 Uber round trip rides for free to the public health clinics and community vaccination partners for them to use with patients who do not have transportation to and from the vaccination site so that they can have that transportation to be vaccinated. Additionally, we know that for a lot of people, providing a government issued form of identification is a barrier to getting vaccinated. So we actually have many options for verifying your age, for example, where you live and where you work when you come to one of our vaccine appointments that don't require you having a government issued ID. If you go to our website, either in English or in Spanish, in English it's vaccinatelacounty.com, and in Spanish it's vacunatelosangeles.com. You can see the list of all of the eligible or acceptable documentation pieces that you are able to provide when you show up for a vaccine. As Dr. Brown mentioned, vaccines are always free and they're available to all immigrants, regardless of immigration status. Also important to find out that getting vaccinated does not impact either your current or your future immigration status, and it doesn't affect your green card eligibility. It's not considered in a public charge test. And just as a reminder, as always, medical information, including information about vaccinations, is private and not shared with immigration officials. We continue to add to this portfolio of strategies constantly, and we're watching our data closely. We'll know within a few weeks whether our efforts are working to increase vaccination rates for those living in our hard-hit communities and under-vaccinated areas. But I do want to note that the vaccination effort provides an opportunity for businesses, both large and small, to really step up and take actions that can help have a huge impact on the health and the safety of their workers and people in our community. So large businesses can work with a healthcare provider to set up on-site vaccination for their workers, assuming that their workers are currently eligible, like people who work in food and agriculture. But if that's not possible, businesses are asked to please give their workers who are eligible to be vaccinated paid time off to get their vaccine so that no one has to choose between being paid and being vaccinated. So those are some of the things that we can share about sort of our efforts. Of course, questions always arise as more populations become eligible. And so specifically for food and ag, which is a particularly large group in terms of the number of people that fall into that category, we have set up an email address, which is foodandag, so FOODANDAG at ph.lacounty.gov for businesses and workers who fall into that category to get their specific questions answered.
Very, very good information. And I've got a couple questions for you, Dr. Gonzalez, because I've heard this here with some of our community members. As we know, so many of our community members are that sandwich generation where they might be taking care of their children and also taking care of their parents in their home. And some of us don't recognize that we are a caretaker for our family. So if my 65-year-old or 70-year-old mother, I'm glad she's not on here because she'd kill me if I ever said that, and she's not. But if she was needing to be vaccinated and I was helping to provide care for her, is there a vehicle for me also to get vaccinated as a caretaker, even if I'm not necessarily a licensed caretaker? Or how is that handled? And is there anything that I can bring forward to show that is happening, that I am caring for this individual?
So there are individuals who have care that is offered to them because they qualify and they get that care through local regional centers. So if you're one of these individuals that provides care to an individual who's receiving services from a regional center, then yes, you can be eligible, assuming that the person that you're caring for has one of these conditions, which they probably will because they qualify for services from the regional center, and you are considered their primary caregiver, then you can be then provided the vaccine. As long as you provide documentation from either the regional center, or I think we're even accepting some self-attestation forms, possibly saying that you fall into that category. But you should be able to get such a letter from the regional center directly, and that would be the preferred documentation. For other individuals, like the sandwich generation that you bring up, who are sort of informally providing care to someone who's a senior, generally we don't have a special carve out category for those individuals, unfortunately. So they should continue to do their best to get that senior person actually vaccinated themselves, because that would be the best way to protect that individual who's a senior, is to have them be the ones that are vaccinated. Until and in addition to waiting to be eligible to get vaccinated yourself as the caregiver.
I think a lot of the community, Dr. Gonzalez, and to all of our panelists here, believe that we just have this immense supply of vaccines and we're picking and choosing who we want to vaccinate based on priority and the like. But I think what we all know in being in the industry, that the supply is not meeting the demand at this point. And I think it's just something that we always have to continue to reiterate in these discussions, that we're working with the supplies that we have, right? And we have Dr. Eloisa here in the Department of Public Health and Los Angeles County, because we're seeing a lot of vaccinations happening in there. Not where we need to be, not where we've got to be, but in partnering like this, it's critically important. And Doctor, maybe I could ask you, how or what do you see as the importance of working hand in hand between the county and the service providers like Altamed? What's the value that you see there, and how does this type of work together collaboratively better impact our communities?
Milan, thank you so much for that really great question. I think that the partnerships that we have are probably one of our most valuable resources. As you know, we've been doing these megapods, from the very beginning, and these megapods are few and far between. I mean, there are 5 across the county that are drive-through, and then we have a couple in addition to that are available for people to walk up also. But I mean, that's 7 in a county that's over 4,000 square miles. So oftentimes it's very difficult for people to be able to access these because of transportation issues in large part. But I mean, they're just very far away from where people actually either live or work, by and large. So these partnerships that we have with partners like Altamed really are going to help us move the vaccine to where people are and not have them come to where the vaccine is, which is up until now been very limited. And the reason, I mean, there's reasons why we've been doing it this way. It's because, as you correctly pointed out, Milan, we are not getting enough vaccine yet to be able to provide to all of the pharmacies, all the healthcare providers, so that they can vaccinate their patients, for example. We've had to sort of make the best and most efficient use of the few vaccines that we have been allocated so far. And so the best way to do that so far in a large scale effort, the way that it's being rolled out in LA County, is through these megapods. But moving forward, that's really not going to be the hopefully the standard way or the only way. We really need partnerships to be able to get it, the vaccine that is, to the individuals who need it the most at a location that is most convenient to them. And really, we can only do that with partnerships like yours.
Amazing. You nailed that. That was a very good way. And it's what we all believe. And it is through force multiplication and working with our community partners that we can really echo and ripple this information and the right information out to our communities that so desperately need it. And so I really just want to thank you, Dr. Eloisa Gonzalez. And if there's any other little pieces here, I've got a couple other questions that I want to throw out to the group, if that's okay. And but Doctor, any other points that you want to make? I will one couple of things that we are going to share links, the phone numbers, and all that with everybody that's on this presentation now, and it'll be hosted on our website as well. So everybody know that that'll be coming forward to you all. Okay, so that will be there. And I did see, I saw some printed materials, a request for some printed materials to address some of the fears of Latino and African Americans about getting the vaccine. Are they in English and Spanish? And we do have those materials. So we'll make sure that that's a link is also provided to you all there. Okay, so we'll make sure that we get that out to everybody. But Dr. Gonzalez, any other last little points that you'd like to make before I start to spring out some questions to everybody?
Sure, thank you. Yeah, so probably one of the most important things I really want to point out right now is once someone does get an appointment for a vaccine, or they go to a location where they don't have to have an appointment at any point, they're there, they're physically present at a vaccination site, ready to receive their vaccine. They need to know and start preparing now what the things are that they're going to need to present as documentation. So there's going to be three things, right? So one, they're going to need a photo ID. It doesn't have to be a government issued ID, though they have it, that's great. It doesn't even have to be a United States ID. It can be an ID from their home country, like a driver's license from, Paraguay or wherever they're from. And it doesn't even matter if it's expired. I mean, we'll still accept it. So basically anything with their photo and their name to verify their ID. That's one. Two, they're going to have to provide proof that they either live or work in LA County. So again, whatever form that is, it can be a utility bill, it can be, even at some point, I guess, a self-attestation letter. So if you have something that's more official, that would be fantastic. And then three, you're going to need to provide something that provides proof that you work in a sector that's eligible to be vaccinated. So you're a food and agriculture worker, you work at Starbucks, for example, whatever it is. So for some people, one document may show all of these things, like a work badge that has their photo on it and the address of their workplace. Dr. Cheryl Brown had said before, like one and done, like one document may serve all three purposes, but it may be that you need a separate document for each of these, and that's okay. So, you can bring a pay stub, anything else that shows where you work, for example. All of the list of the acceptable documents, like I said before, are available. Examples on our vaccinatelacounty.com website under the section that says, documentation. So I would urge folks to go there, read, I think there's 7 steps, read all 7 steps so that you're prepared, so that you know what you're going to need to do and what you're going to need to have in hand at the time that you show up for your vaccination. Because what we really do not want to do is have to turn anyone away once they're at a vaccination site. We really want folks to be vaccinated, make it as easy as possible, which is why we have all the information posted so people can start preparing now.
Very, very good. Very, very good information, Dr. Gonzalez. And I have seen that, and I've seen the breakdown in some of the qualifying documents. So let's all be really mindful that we got to go on there and check that out. And if you know somebody that's needing to get vaccinated, let's be sure that you help guide them through that process. Okay. It's really important information. And we don't want people to wait, because we know that sometimes the wait at these vaccination sites could be a little bit of time. So I want to just make a couple quick notes. We're going to start to share some of the resources that are available to everybody here. So as I mentioned, you could go to altamed.org/vaccine for the critical information and to sign up for the COVID alerts. Okay, that's what's going to be very important. All right. And you can see here, we've got the Cal State LA vaccination site. We've got the County of Los Angeles Department of Public Health, and also the resource for Orange County. Again, you don't have to furiously write all these things down, and we will definitely get this delivered over to you all. And just so everybody knows as well, I wanted to give a few thank yous to Miss Beatriz of the City of Commerce, to Rosalba, to Natalie, to the individuals that were submitting questions to us. Thank you so much for your engagement and participation. I wanted to thank everybody on our panel, not only for participating here, but for the passion, the tenacity, and the drive that they have to get our communities healthy and vaccinated. Okay, we've got to make sure that we're getting the right information into the hands of our community. So I just want to thank you all so much for everything that you've put forward. And lastly, I know that there's a lot of questions that are coming up, that have come up, and we may not have answered all of them, but we will come back and provide an answer to those questions. We've got your names here. We'll make sure that we've got a way to contact you, and we will be in touch. Lastly, these types of virtual sessions will continue to happen, and will continue to happen in different formats, right? So we want to be sure that we know how to contact you, and we are providing the right information that you would like. So please take a moment, if you would, to help fill out the survey that my amazing team member, Carla Torres, has just put up into the chat box. It's going to help us stay in tune with the questions that you have. We also have a live session with one of our providers, Dr. Ilan Shapiro, happening every Thursday from 12 to 12:30 on Facebook and YouTube Live. If you're able to connect with us there, every week he'll be providing some of the most up-to-date and critical information and updates for our communities. And if you can't make that live session, it's stored on our YouTube channel, and it's stored on our Facebook as well. So be sure to go back and take a look at some of the things that are happening week over week, okay? Lastly, these are the folks that are here for you all. If you have any questions at any time, be sure to email us, be sure to call us, be sure to come in and ask us, because all we want to do is make sure that you're informed with the right information. Whether you come to Altamed or you go someplace else, we want you to be empowered with the right information, okay? So be sure to reach out to us with any questions at any time and in any medium. We're here for you, okay? So once again, I want to thank everybody. It sucks that we can't do a round of applause, but I'm going to do a round of applause for everybody on the panel. Thank you all so very much for your work and your dedication and the information you provided to us today. And we look forward to seeing you all very, very soon. Thank you, guys.